PharmaPal.
You're listening to Bloomscast, the official podcast of Blooms.io, home of the bioactive library for mass spectrometry instant optimization. Let's dive into the latest in natural chemistry, bioactive discovery, and the future of lab innovation.
Today, we're plunging into a really fascinating and, well, somewhat controversial area, using herbs to induce labor.
Right. It's this interesting mix, isn't it? You've got these deeply rooted traditional beliefs bumping up against, modern scientific checks.
Exactly. It's seen as natural, maybe gentler, but the science around it during pregnancy, especially for something as critical as labor, needs a close look.
Definitely. Many view herbal remedies as inherently safe, but their actual effects, particularly on uterine contractions and labor progress, that's where the questions really start.
For sure. So to help us navigate this, we've got two main sources we're digging into today. First up, there's a study from Saudi Arabia.
Yes, the cross-sectional one. They talked to postpartum women, right?
Right.
About how many used herbs for labor, why they did it, where they got them, that kind of thing.
Precisely. They interviewed 340 women at King Saud University Medical City. This was back between April and July 2019.
Okay. And the second source?
That one's quite different. It's an in vitro lab study, this one from Bethel University over in the U.S.
In vitro. So looking at tissues in a dish, basically.
Yeah. They took a specific herbal tincture. It had black cohosh, crampbark, partridge berry, and motherwort, and tested its effect on isolated mouse uterine tissue, looking at contractility.
Interesting. So one study looking at real-world use and beliefs, the other looking at potential biological action in a controlled lab setting.
Exactly. So our mission today is to kind of pull out the key insights from both. We want to give you, the listener, a clearer sense of how common this practice is, what's driving it, and what the early science might be suggesting about how these herbs could actually work.
Aiming for clarity, not confusion. Sounds good.
Right. We want to keep it informative, not overwhelming. Okay, let's kick off with that Saudi Arabian study. What were some of the big takeaways for you?
Well, the first thing that jumped out was just the prevalence. How many women were actually doing this? The study found that 31.5% of the women they interviewed in Riyadh had used herbs to try and start labor.
Wow, nearly a third. That's quite high, isn't it?
It really is. It's a pretty significant number. And it wasn't even consistent across the board.
Oh, so?
It actually went up the longer the pregnancy went on. So for women who were between 41 and 42 weeks pregnant, that number shot up to 58.8%.
Almost 60%. Okay, that makes a certain kind of sense. You get past your due date, maybe start looking for options.
Exactly. It suggests, a real push to find alternative methods when things feel like they're dragging on.
Did they compare this rate to anywhere else? Just to get some context.
They did. And that really highlights how much this can vary. They mentioned studies in Malaysia reporting 73% and Nigeria at 67.5%.
Whoa. So while the Saudi rate is notable, it's actually lower than in some other regions. Shows how cultural factors play a big role.
Definitely. Cultural and regional influences seem pretty key here.
Okay, so we know a good chunk of women are using herbs, especially later on. But why? What reasons did they give in this study?
The number one reason, cited by 57.5%, was simply wanting to make childbirth easier.
Okay. That's understandable. A very universal hope, I imagine.
Absolutely. Finding ways to ease that process. What else? Advice from relatives or neighbors was huge, 41.5%.
Right, the social network effect. Hearing it from people you trust.
Exactly. And previous positive experiences matter too, for about 24.5%, plus personal beliefs for 23.6%.
The it worked for mammy, sister, me, neighbor kind of thing makes sense. Any other beliefs driving it?
Yeah, some believed it would shorten labor. That was 26.4%. And being post-dated specifically was a reason for 21.7%.
So easier labor, shorter labor, avoiding being overdue, trusting advice. What about safety? Did that come up?
It did, and this is crucial. 16% specifically said they believed herbs were safe, no side effects. And 14.2% believed they were effective.
Interesting. Belief in safety and effectiveness.
Yeah, and only a smaller group, about 10.4%, mentioned using them specifically to avoid medical intervention, which suggests maybe less a distrust of medicine and more a positive trust in the natural approach itself.
That's a really interesting angle, the perception of inherent safety. Okay, so where were they actually getting these herbs and the information about them? Was it doctors? Pharmacists?
Mostly no. The main source for the herbs themselves, relatives. That was 53.8%.
Over half just from family.
Yep. And nearly 30% sourced them themselves. As for information,
Let me guess. Not primarily healthcare professional.
Yeah. Social media was a big one, 21.2%. Apothecaries, like traditional herb sellers, were 13.5%.
And doctors or pharmacists.
Much lower. Physicians were consulted by only 9.6%, and pharmacists just 3.8%.
Wow. That's quite a gap, isn't it? Heavy reliance on informal networks and social media, very little input from trained medical folks.
It really paints a picture, doesn't it? A strong cultural practice operating somewhat parallel to or outside of standard medical advice channels. And that raises potential safety concerns if the info isn't accurate or complete.
Definitely. Did the study find any groups more likely to use herbs, like based on age or education?
Yeah, they found a statistically significant link with age highest use in the 26 to 35 group. And as we said, gestational age highest at 41 to 42 weeks.
Okay, prime childbearing years and post-term. Anything else stand out?
Well, they noticed higher rates among Saudi women compared to non-Saudi, women with bachelor's degrees, homemakers, and those with fewer previous births. But those links weren't statistically significant in this specific analysis.
Got it. So age and how far along were the strongest factors. What was the study's bottom line? Their conclusion?
They were pretty direct. They called the rate alarming because it's tied to practices not necessarily backed by solid evidence. They strongly recommended more research, especially on safety and actual birth outcomes.
And crucially,
they stressed how important it is for women to talk to their doctors about any herbs they're considering or using. Open communication is key.
Absolutely. A clear call for more science and more conversation. Okay, let's shift gears to that second study, the Bethel University lab research.
Right, the in vitro one, looking at mouth uterine tissue.
Yeah. This one focused on 4 specific herbs: black cohosh, crampbark, partridgeberry, and motherwort, components of a known midwifery tincture.
And they wanted to see what exactly?
They wanted to see if extracts of these individual herbs actually caused the uterine muscle tissue to contract in the lab, trying to find a potential biological mechanism for their use in labor induction.
Okay, so how did they set that up?
They used what's called an organ bath. They put isolated mouse uterine tissue in it, applied water-based extracts of each herb, and then measured the contractions.
And compared it to
the tissue's own natural, spontaneous little twitches, and also to the effect of oxytocin, the standard drug used to induce or augment labor.
Gotcha. A known uterotonic is a benchmark. So what did they find? Did the herbs do anything?
They absolutely did. All 4 of them significantly increased the force of the uterine contractions compared to the baseline.
All 4. Wow. So there is something going on at the tissue level. They act as uterotonics in this model.
Exactly. Suggests they have the potential to stimulate contractions.
Were some stronger than others? Or was it pretty even?
Interestingly, the study found no statistically significant difference between the herbs themselves in terms of how strong the contractions were. But here's something cool. The contractions they produced were comparable in strength to those caused by a specific concentration 10 molar of oxytocin in that same lab setup.
Comparable to oxytocin. That's pretty potent, potentially.
It suggests a definite biological activity. In fact, 2 of them, partridgeberry and black cohosh, actually produced stronger contractions than the oxytocin control they were compared against in this experiment.
Stronger than oxytocin. Okay, that's significant. What about the other 2?
Crampbark and motherwort also showed strong contractile effects, just slightly less potent than their oxytocin controls in this particular setup.
Right, so definite activity across the board. Did the study look into why? Like what compounds in the herbs might be doing this?
They touched on it, yeah. They discussed the traditional uses and known components, like black cohosh, traditionally used for effective contractions, contains things like saponins, though they also noted some research suggesting other parts of it might inhibit contractions sometimes.
It gets complex. Saponins, okay. What about crampbark? That name sounds like it should stop cramps, not cause contractions.
Exactly. Traditionally, it was used to sedate the uterus, ease pain. But in this lab test, it clearly caused contractions. It also contains saponins.
That's a fascinating conflict. Traditional use versus lab finding really shows you need the science, doesn't it?
It really does. Highlights the complexity. Partridgeberry, they noted, is traditionally seen as safe for toning the uterus, leading to maybe more coordinated contractions. Also has saponins.
Okay, and motherwort.
Reported as a uterotonic, but also calming. It has lots of different compounds. Saponins, again, alkaloids. Some related compounds have shown contractile effects. But importantly, they also noted some sources flagged motherwort as potentially unsafe during pregnancy.
Right. So potential benefits, but also potential risks flagged even in the traditional literature sometimes. Did they propose a mechanism for how these might work? You mentioned saponins a few times.
Yeah, they suggested saponins could be a key player since they're in all 4 herbs. The idea is maybe they disrupt cell membranes, letting calcium rush in, and calcium influx is what triggers muscle contraction.
Ah, the calcium channel idea. Plausible. So what was the final word from this lab study?
They concluded that these in vitro results give some initial empirical backing to the idea these plants can act as uterotonics. They do increase contractility in mouse tissue.
But it's always a but with lab studies.
A big but. They were really clear. This is a lab, it's mouse tissue, it doesn't directly prove they work or are safe in pregnant humans, it doesn't look at the herbs combined or side effects or effects on the baby. More research needed, especially in living organisms.
Crucial caveats. A promising lead, perhaps, but miles away from clinical proof for use in people.
Absolutely. Okay, so let's try and connect these 2 threads. We have the Saudi study showing lots of women using herbs driven by belief and tradition.
And we have the lab study showing some of these herbs do have a biological effect on uterine muscle tissue, offering a potential how.
Right, but it also highlights that huge gap between the practice and the scientific validation, doesn't it?
It really does. The belief is strong, the use is widespread, but the rigorous evidence for safety and effectiveness in humans is still, well, pretty thin based on this.
And that crepe bark example really drives it home. Traditional use for pain relief, lab shows contractions, it's complicated.
Totally. It tells us we can't just rely on traditional alone or the natural label. These are active substances.
And the Saudi study showed that perception of natural means safe is a real driver, alongside social influence, even with limited scientific backing.
Which makes the limitations of both studies so important to remember. The lab study. Mice, isolated tissue. Individual herbs, no safety data in humans.
And the Saudi study. Self-reported data, can't prove cause and effect, doesn't tell us if the herbs actually worked or were safe for those women.
So, putting it all together, what's the main message for our listeners if someone's pregnant, thinking about this?
I think the absolute key takeaway is communication. Talk to your doctor. Talk to your midwife.
Yes. Be open about anything you're considering taking, including herbs. Just because it's natural doesn't mean it's risk-free or won't interact with other things.
Your healthcare provider needs the full picture to give you the best advice for your specific situation. It's about informed decisions.
Couldn't agree more.
Okay, so let's wrap this up. Key points from today's deep dive.
Well, we saw significant use of herbs for labor induction in that Saudi group, driven by hopes for easier labor and strong social traditional influences.
And on the science side,
we saw initial lab evidence that specific herbs like black cohosh, crampbark, partridge berry, and motherwort can make uterine tissue contract, possibly due to things like saponins. But this is preliminary, in vitro data, not proof of safety or effectiveness in pregnant women.
Right, which leads us perfectly into our final thought for you, the listener. Considering how common these practices are and these early scientific hints, what kind of research do we ethically need now?
Yeah, how do we really figure out the true risks and benefits for both mother and baby? And how can we better bridge that gap between cultural beliefs and scientific evidence to give people guidance they can trust?
Something to think about. We really encourage you to consider these complexities and always seek out reliable, evidence-based information and talk with your healthcare providers when making health decisions.
Thanks for tuning in to Bloom's Cast, brought to you by blooms.io. Stay curious, stay connected, and we'll see you next time on the frontier of natural product innovation.
PharmaPal.